getting ready for Astrid's operation on Monday, and I'm starting to feel a little bit terrified. By the way, my name is Harriet. Astrid is my daughter. Astrid has a condition called hypoxic ischemic encephalopathy, along with many other secondary conditions. I have mentioned on previous videos that Astrid is having an operation. The operation that she is due to have on Monday is a tonsil and adenoidectomy. The reason for this is because Astrid has an occluded airway, and because of her tone, she gets very floppy. Her tongue can kind of block her airway, and so we need to try and create more space so she can breathe easier. What are you looking at? Now, Astrid's had one previous operation before. She had a general anaesthetic to put in her gastrostomy tube, which is relatively simple surgery, and there was absolutely no complications whatsoever. This time, they've been very cautious because of her airway issues, and we're having to go to a different hospital, which has a paediatric intensive care attached, and also they have booked her a high dependency bed for post-surgery in case there is any issues. Now, usually a tonsil and adenoidectomy would be day surgery and the child could go home, but they've said Astrid, that's not the case for Astrid because she's a more complex child and has more complex needs. She will have to be in for a minimum of 1 night, potentially more, depending on how she does. With her pain management and recovery from the general anaesthetic. And I am absolutely terrified, of her going under a general anaesthetic, what that will mean for her, whether or not she will cope. If this surgery is the right move, if this is going to actually help her in the long term. Like, there are so many questions going around my head right now, and it's terrifying. Like, I don't know if we're making the right decision, and yeah, the more it leads up to it, the more anxious I'm getting. I have nightmares about it. Yeah, it's really, really scary. And additionally, it's hard because I can't explain to her that this is going to happen. Well, I can, but I have no way of gauging her understanding. So, we're just going to turn up and someone's going to put her to sleep. Like, it just feels a bit almost unethical. Like, I know we're acting in her best interests, and that is, like, the main factor, but it I don't know, it's so scary, and yeah, I'm feeling super duper anxious about it, and I just want the best for her, and I want her to be able to breathe easily, and this is the recommended route to that, or at least we have to try this before we can go on to try other things. But it just seems really, I don't know, I'm really scared. But follow us along for more updates. I will try and bring you along with us on Monday, and give you updates as the day goes on. But yeah, 2 days prior and I'm feeling very, like, the butterflies are there. So we are on the last day before op day, and I'm still absolutely bricking it. So we've spent today prepping. So we've dropped off her brother with his grandparents, as they are going to have him overnight because we need to leave really early in the morning tomorrow, just to try and not disrupt his routine as much as possible. And then we've been packing, because we don't know how long she's going to be in for. It's quite tricky, although we are very used to packing hospital bags. So yeah, I've packed as much as I can for now, and then we will have some, like, her medications and stuff extra to go in either tonight or tomorrow morning. So just getting ready for that and just trying to ease my anxious brain and be as prepared as possible. And I think we're going to spend the afternoon trying not to overthink. So if anyone's got any handy tips on how we do that, we would be greatly appreciated. Look at you, hey? But I don't know if you can hear that noise. That's the noise we're trying to get rid of with this operation because she's struggling to take in a breath. So fingers crossed this works. I want to say a massive thank you to everybody who wished us good luck for today, and she is now post-op. Today has been an absolute roller coaster of emotions, and I cannot believe how many of you over the last kind of 24 hours have sent me well wishes and all the best for her. I'm really touched by all your support. Today was tough, but we got through it, and now here we are out on the other side. The procedure itself went really, really well. I mean, she was in theatre for less than an hour. When it came to waking her up, we had a few issues. She was very slow to wake up. She needed quite high levels of oxygen. She had a huge increased work of breathing and was really noisy with her breathing. Got to the point where we had to call outreach to come and have a little look at her. These are nurses who are experienced in critical care, and we were trying to decide whether or not she needed to go to high dependency or whether or not she needed to be put on high flow, optiflow oxygen, which is preferred method when you're giving lots of oxygen. It's quite dry, so high flow is moist and it's got really high pressure, so it can help with keeping the airway open. We think what's happened is because she's been poked around a lot, she's got quite a lot of inflammation there, which is maybe occluding her airway, making things a little bit swollen and increasing her secretions. She has been in quite a bit of pain, so it's been quite tricky to get on top of that. We spent 3.5 hours in recovery, waiting for her to come round enough and be well enough to come back to the ward. So we're now on the paediatric surgical ward. She's being monitored. She's on a continuous saturations monitor. I mean, right now her oxygen saturations are 94% and she is on oxygen, just under a litre of oxygen at the moment. And she's very much in and out of sleep. She wasn't really settling in her cot, so I've just put her on me for a little snuggle. Normally she absolutely loves her dummy to sleep. It's okay, baby. But I think she's a bit sore and she doesn't want it, and she's struggling a little bit with that, aren't you, Bob? It's okay. But we're okay. We are going to be in hospital tonight at least, and then see how we do in terms of feeding and pain management over the next 12 hours, and then review the situation. Okay. Yeah. It's okay, Papa. But yeah, we're okay. We're doing okay. Thank you all for all your well wishes, and keep the luck coming our way. Keep the luck coming our way. I'll keep you as updated as I can, and follow us along for updates.